how safe is sedation in order to do dentistry? Do people sometimes not wake up from it, or do they wake up damaged from it? Hello, Dr. Johnson. Helmut here.
Hey there, Helmet.
Hey, Dr. Johnson, we talked a lot about that you are sedating people so they get more work done, they get better work done, or they get it done at all because their anxiety or their whatever other condition would otherwise prevent them from doing dental work. And I'm sure the whole world more or less knows that dental work is important, not just because we look bad and not just because we can't chew when we don't have all our teeth and all that, even though all those things are super important. After all, try to look bad and get a job in a bank or as a waitress, so it wouldn't matter what. Try to get a girlfriend looking having bad teeth. You know what I mean? Try to
Yes.
keep your wife having bad teeth. I'm not so sure,
Yeah.
you know. I mean, it's just not nice, you know. Nothing worse than kind of like talking like this
Sure. Sure.
so people know about that. But also it's just having a load of other problems, such as immunity system. We know that a cardiologist, if he wants to do a heart transplantation, and not just a cardiologist, many other doctors who do heavy operations, they first want a clean bill of health from a dentist because the infections in the mouth are so strong,
Correct.
they ruin the immune system so badly that the person will have a hard time sustaining and surviving the operation, and thus the doctor doesn't do it. If it does that, and now we're coming out of 2 years pandemic, where the immune system or having a good immune system, after all, I think didn't get tutored enough, didn't get boosted enough, that we should work on that. But I think most people got the idea that having a good immune system couldn't possibly be a very bad thing, more so than before, maybe. However, all that said, when there is immediate danger to do something, we sometimes like to, often, most of the time, in fact, we people, all of us, like to delay the potential problem down the road for even longer in order to avoid the severe problem now. So the question is simple: how safe is sedation in order to do dentistry? Do people sometimes not wake up from it, or do they wake up damaged from it? What? Please tell us about it.
Excellent question. I'm glad you said that. Anesthesia, sedation in the dental office is very safe. It is as safe as it is as long as you have a trained professional who is performing the service for you. Us as dentist anesthesiologists are trained very well, and we are probably the best, well, not probably, we are the best trained to be able to work specifically in the dental office because we have an intimate knowledge and understanding of dental work, what good dentistry looks like, what should be happening, and we manage the airway very, very well. Now, there's always risk with any anesthesia and surgery, and the same risk that you would be exposed to in a hospital in the surgery center is the same in the office. And you'd have to sign a consent that goes through all the risk, benefits, alternatives. I have treated thousands, and my colleagues, we've treated thousands of patients without any incident. Have there been situations where there were maybe an emergency of sorts? Yes, but nothing that required hospitalization or anything, just in a normal service of doing your providing your care to your patient. There have been instances in the media where you've had tragically children who have passed away by going, who have been sedated in the office and those types of things. Those situations are always tragic and are extremely rare, however. And in many of those cases, the is either some underlying medical condition that was never diagnosed previously, or there was some individual who would have been negligent in providing the care. And in every profession, we know that there are professionals and some who are not so professional. And unfortunately, patients would have suffered, either passed away or had brain damage of some sort because of that. And in many of these cases as well, there have been individuals who have not been trained very well or who have been trying to dabble in doing both procedures, both the anesthesia and the dentistry at the same time. and not being trained well in anesthesia causes a problem.
All right. Brought up 2 points, which I would like to take up just a little bit. So it is not a good idea that a dentist, you are a dentist, and there is a reason, a clinical reason, apparently, from what I hear, um, that the dentist who does the procedure should not do the anesthesia because of.
Right. That is my personal belief and the belief of many of my colleagues as well. Not all my colleagues feel the same way. And I'm not trying to cast aspersions on anybody in particular. But what I'm saying is if you are not well trained in anesthesia, you've not gone through a residency program for 3 years at least that provides extensive training. My belief is that you should be doing the anesthesia alone or the dentistry alone because you need to focus on the patient and what their needs are. Because if there's anything that can happen at any point, you need to be able to intervene without having be distracted with anything else. I personally, even though I could, would not do both procedures. I want to focus on the anesthetic I'm providing my patient undivided. So I give them the best care possible and have a better outcome, in my opinion. That is how I feel it should be. And that is the feeling of many other providers as well.
Okay, thank you very much. And it's a comforting answer to us patients. So what you're basically saying, while the whole world is doing multitasking, this is not the place to start.
Absolutely not. Not at all. I can't find very good reasons to do both.
Wonderful answer. And as I said, a very, very comforting. The other point I wanted to ask before this video is getting too long is you said that sometimes a pre-existing illness wasn't diagnosed. Who takes responsibility of making sure that's happening in your practice? I'm just talking about your practice. Are you,
Sure.
before you go into this, is there, tell me.
Right. For most patients, I would receive, uh, they go to their pediatrician or their primary care doctor and receive, they get a checkup, a physical. I get all the information that comes to me, so I can make a determination of whether or not they can be seen. Most kids and people I see are healthy, but if there's any question in my mind, I send them for follow up evaluation. So when something comes back, then I have an opportunity to see what is going on and I can make that determination. So I don't fly blind. In my practice, I make sure I know what's going on in terms of the child's health, if they've ever had any previous surgeries, anesthesia, medical conditions. Many kids have asthma and those types of things. So I have that information. That's my responsibility. I make sure that that happens prior to putting a patient to sleep.
So being a doctor, being a dentist, being obviously well trained in a many things and knowing the anatomy of the body. So when you get a report from a general physician or whatever it may be, which just you probably notice whether it looks a little shallow, like, hey, we need this test, we need this. These two tests, but they're not coordinating the way I want to. Maybe nothing wrong, but please check because I want to know. So you take care of that before you put the patient under.
Absolutely, yes. So even though a physician may say to me, um, from their perspective, that a patient can be put to sleep safely, I am the final arbiter. I decide whether I put that patient to sleep in the office or not, regardless of what the physician says. So I tend to be pretty conservative when it comes to treatment. But I am the final arbiter. So once I have all the information necessary to make a decision, I make a decision. If I don't, I send the patient back to get what I need.
Wonderful. Wonderful to know for us patients. Thank you very
Yes,
much.
you're very welcome.